Hi, this is Dr. James Cook, and this is an update on dermal and soft tissue fillers, Part 2. So here's a patient photo after receiving Juvederm Ultra to the nasolabial fold area, or the parentheses, that we discussed in the blog entry. So you can see these parentheses, or nasolabial folds, and I think you can see a nice correction here after the Juvederm Ultra. Now here's a patient with a similar problem, but her folds are a little bit deeper, these parentheses. I think you can see a nice correction here, this area being filled in. And the injector used Ultra Pulse, which is a thicker formulation, and the physician or nurse injector picked a more robust formulation to fill in that relatively deeper area. Here are some other areas that are amenable to treatment with a hyaluronic acid filler such as Juvederm. The malar smile lines underneath the eye to increase projection of the cheek area. We have other fillers that are very good for this too. And then, as I mentioned, the nasolabial fold, or parentheses. Here are some lower face areas that are well treated with a hyaluronic acid filler such as Juvederm. The lips, to try to plump the lips up. These perioral furrows or vertical lines that we discussed in the blog. These are seen commonly in smokers. Also because of the mouth muscle movement, these fine furrows tend to develop. Then we also talked in the blog about the marionette lines, and this is a perfect example of a marionette line, kind of a puppet type of mouth crease here and also here. Now, one of the fillers, and this would be a soft tissue filler because it would be not injected into the skin, but actually under the skin. So it's a subcutaneous filling substance. In autologous fat, what that means is that the physician is taking your own fat and then washing it and cleaning it, and then re-injecting it in an area that needs to be filled. And liposuction has made harvesting of fat a much simpler procedure than in the past, and we can clean this fat and put it into a syringe and then put it in another part of the body, such as the nasolabial folds, the parentheses that the patient needs an enhancing effect. Since it is your own fat that is used, there could be some element of stem cell favorability there. And we like to think of fat as being semi-permanent. In other words, it doesn't, not all of the fat stays, but some of it does. And typically you need more than one injection over time, and your physician or nurse injector will talk to you about that. What are the indications for fat transfer? Well, these will tend to be deeper folds and wrinkles than we talked about with the hyaluronic acid filler such as Juvederm. So the indications would be if the patient had deep facial wrinkles and furrows. It's very good for the nasolabial folds, the parentheses, the marionette lines that I showed earlier, to plump up the lips. Also the tear trough deformity, it's kind of a technical term, but that's a area near the eye that looks sunken in. Cheek contour deformity, so in other words, people that lose fat in their face. Loss of fat in the face actually is associated with the aging process, and we can take fat from elsewhere in the body and then put it there. And then depressed and atrophic scars are also a great indication for fat.